Okay, we are going to get started. For those of you who haven't joined us before, I am Lauren Block. I am the Director for Pathways to Resilience. Today, we are doing a session about supporting foster and kin family recruitment and retention. I am really excited. We've been planning this session for quite some time. And we have four amazing speakers. For those of you who don't know, we host our Learning Network sessions on a regular basis on an array of topics that are open to the public. This session is going to be recorded, so I want everyone to know that. And we encourage folks to ask questions in the chat, and also feel free during the session. If you've got questions, you can also raise your hand and ask your question verbally, whatever works for you. We don't wait until the end for these sessions. We go right up to the end. So ask your questions as we're going. I want to start this session by acknowledging that separating children from their families in and of itself can be a very traumatic experience for a child. And where possible, keeping families together and providing added supports is ideal to really keep a family intact. That said, we know that in certain circumstances, it is not possible to keep a child with their family or with kin. And in those cases, it may be necessary to use foster parents or resource parents, but it's still always ideal to maintain connection with the family within the community when we can do that. And so I just wanted to start by sort of centering with that thought. I am myself a foster parent, working towards adoption. So, I'm not a resource parent, I am a foster parent. We have four speakers that are joining us today. We have Lindsay Gilchrist, who's the director of CHAMPS Colorado, David Hansel, who's senior policy advisor for child welfare policy at Casey Family Programs, Carol Schofer, who's our senior director for quality parenting initiatives with the Youth Law Center, and Jill Yordy, senior policy specialist at the National Conference of State Legislatures. I'm going to have them each introduce themselves just a little bit further as I begin to ask them questions and we go through the session. And again, I strongly encourage folks to just raise your hand or use the chat if you have questions. We're going to share a lot of links during the session as well when our speakers are talking about different issues. So I'm going to start with a question first for David and then Lindsay. David, can you tell us a little bit about what the landscape looks like regarding placement and retention of foster parents and kin at the national level?
Sure. Thank you, Lauren, and thank you very much for inviting me. I'm delighted to be here. Let me just first of all say a few words by way of introduction. For those of you who may not know Casey Family Programs, we are the nation's largest operating foundation that is focused on safely reducing the number of children in foster care. We, as a foundation, we as an organization, believe that every child deserves a safe, strong, and permanent family, that every family can thrive with the support of a caring community, that every community can create hope and opportunity for all of its children and families, and that each and every one of us, no matter what our role is, each of us can play a role in building these communities of hope across America. So that is really the vision that drives us as a foundation, the Casey Family Programs. So our goal is safe reduction of number of children in foster care, and I'm happy to say, big picture, that we have seen some significant reductions in the number of children in foster care across the country. And that has been a consistent trend over a number of years now. That's true nationally, but we also see a lot of variation from state to state. We see some states where numbers have dropped, some very, very significantly. We have seen some states where they're stable, and we actually have seen some states where the number of children in foster care has increased recently. The other thing we see, and this is unfortunately pretty uniform across the country, is that we see significant overrepresentation of Black children and American Indian and Native children in foster care, and that is true in virtually every state in the country. So there clearly are significant challenges yet to be faced. That's the overall number of children in care. We are also very, very focused on and committed to trying to make sure that when children must be placed in foster care for their own safety, that whenever possible, they are placed in what we call kinship placement. That is with family, with other friends, with people in their community, people that they know and have a pre-existing relationship with. We have seen across the country a modest increase in the proportion of children that are in kinship placements. But again, there's a lot of variation. There are some jurisdictions around the country, some states and some counties, in which as many as 60 or 70% or even more of those children in foster care are in kinship placements, which is wonderful. But the national average is closer to 30-ish%. So there's clearly huge room for improvement across the country. And the research is absolutely clear. As Lauren said at the beginning, removal of a child from their home and placement in foster care, even when it's necessary for their safety, is traumatic for a child. And there is no substitute for family. And so when children must be placed in foster care, the research and data tell us that that trauma is minimized and that the outcomes for that child are improved when they are placed with family or others that they know or with whom they have a relationship. And so we at Casey are working with jurisdictions around the country to help them to shift practice and to embrace what we call a kin-first culture, always first looking for a kinship placement where that's possible. That's not simple. In fact, it's challenging for a lot of jurisdictions because our systems, our child welfare and foster care systems, were designed around the idea of stranger foster care, not kinship care. And so it can really be a very significant culture shift for a child welfare agency to move toward a kin-first culture. And we think that's important to do, not just at the point where a child is removed from the home and placed in care, but throughout a child's time in care, because sometimes it isn't possible to find a kinship placement immediately, but it's important to continue to look for family options with whom to place that child. So we focus on placement of children in care. We also have to focus, and we're seeing, again, some progress around the country around supporting kinship caregivers. It's not an easy thing for any foster parent to care for a child. It's challenging, but the needs of kinship caregivers are often different from those of other foster parents, and they sometimes require a different response. So well, I would say overall, we're seeing progress around the country. There's still some significant challenges that all of us are faced on, and where we continue to need to see greater progress.
Thanks, David. Lindsay, you're in Colorado. Can you introduce yourself briefly and then tell us a little bit about what you're seeing in Colorado?
Sure. Thanks, Lauren, and thank you so much for having this discussion. I'm so honored to be here with the other panelists to talk about this topic that is near and dear to my heart as well. I am the director of CHAMPS Colorado. CHAMPS Colorado was launched about 4 years ago with the vision to come alongside the county departments and the Colorado Department of Human Services and strengthen the partnership between foster and kinship families and the staff, and with the idea that they are vital components of the child welfare system, and we all work better when we work as a team around a child and a family. So, and then I am also a foster and adoptive parent myself. So, been working in this space for several years now, and great to hear the national stats as David outlined. And I think Colorado is one of those states that is placing kids coming into care in kinship homes at much higher rates. That has been a recent shift, I think, both from what David was referring to as that kin-first culture. So it's been a culture shift in Colorado of a real value of ensuring that kids can stay with family. But also, there have been some really significant legislative changes that have required counties to really look and make all efforts to ensure kids are placed with kin. So that in and of itself is exciting. I think we all, as David stated, we all strongly agree we want kids to be in families as much as possible, and families that they know. And so I think the challenge we face now is the next question of how do we ensure that kids can stay in kinship placements, that we're fully supporting those families. And I think that as David mentioned too, kinship caregivers have different needs. There's a lot of overlap, but foster parents go through training. They have a lot of thought and preparation in the process, and they get the time to do that. and grandma who gets a phone call that her 4 grandchildren need a placement that doesn't have the time to prepare. So really ensuring that those families are supported is something I think Colorado really is looking at, and how we can do that better given the high rates of placement. And then I think the other challenge that that the space is facing is that foster parents, given that we're placing high rates at high rates with kin families, thought the kids that are actually coming into traditional foster homes have some really high acuity needs. And so we really need also to be supporting those foster families as they support the kids in their care. And we need to retain families so they have lots of experience and lots of understanding of how to truly parent these amazing kids that need very specific support. So that's sort of the landscape in Colorado and where we are. Again, really proud of the fact that we are placing at such high rates, but really want to make sure we take the next step and ensure those families are really supported.
Thanks so much, Lindsay. Carol, I want to turn to you for a moment. If you could briefly introduce yourself, and then I'd love to hear a little bit more from you about what you see as the biggest barriers to retention. Oh, and you are on mute. Carol, you're on mute.
Great. Okay, I'm sorry. I'm Carol Schofer. As she said, I work with the Youth Law Center, which is a national advocacy organization working on behalf of children and youth and their families involved in the child welfare and juvenile justice system. I'm participating in this because of our Quality Parenting Initiative, which is an approach to foster care particularly that focuses on building strong relationships all the way around. So strong relationships between parents and their children, between birth parents and resource or foster parents, or kin and former foster parents, caseworkers. So we see, here's what I see. The problem in child welfare, a problem in child welfare in general, is that it is a bureaucracy which looks for standardization, trying to deal with individual needs of children and families. And there's a fundamental tension there. And anything that or any innovation in child welfare has to address that tension. And to me, there is a big tension around kinship care, because it's easy for bureaucracy to move from kin first to we're just going to find kinship and step out of the picture. We are not going to really support them differently. In a sense, you know how people always are talking about how most medical procedures were tested on men, and now we realize that women have different needs? Well, I think kinship is very similar. It's not just support in the traditional way that we think of support, that is, more money, maybe some more training about kids. It's dealing with interfamily problems. It's recognizing that when we say kin, that's a very big generic word that is applying to all different kinds of people. And if we approach all kin as the same, it's really different if you are talking about my daughter and her child, as opposed to my sister and her child, as opposed to my brother's cousin who had a child and I didn't even know the child existed. But when we treat them all as the same, and that placing with kin is the success in itself, which I believe David was referring to too, as if ensuring an excellent experience for kin and for children is the most important goal. That's what I see as the barrier. I think the most traumatic thing that can happen to kids in the system is unnecessary and unplanned moves. I think even more traumatic than the most is when it's from a kinship placement, and particularly a kinship placement where you had a previous relationship. So now you're not just losing your home, you're losing your grandmother. And unless we recognize that and put extra efforts into making sure the things we know are going to cause those disruptions. And I really look at the disruption as more important than retention. Retention makes a lot of sense when we talk about stranger foster care, but we're talking about making sure this child remains with that family. So unless we start to address those problems right away, and they're much broader problems than just the behavior of the child, then lack of resources, there are deep family issues. And again, as you said in the beginning, we want to keep all kids at home. We want to support families better. Well, this is part of supporting families better. So I'm not sure if that's responsive to your question, but this is, I think, the heart of the issue. Are we going to look at this as an individual family, as we would want our family to be treated? Or is it going to be just another bureaucratic checkbox? Looked for relatives, found a relative 17 states away who doesn't know the child, ship them off to the relative, we've done our job. Which sounds harsh, but it's not as harsh as it's more realistic than it is just harsh.
Carol, I think I think Carol's Wi-Fi.
Oh, I'm sorry. Can you not hear me?
Yeah, you were breaking up, but I think we caught most of it. I'm going to go to the next question. So I want to talk a little bit about policy. You talked a little bit about the bureaucracy and the individuals and trying to fit the bureaucracy and the individuals together. I want to start with David and then go to Jill to talk a little bit about David, start with the federal level, and then Jill to talk to us about some state examples. And then I see we have a question from Gina in the chat about Colorado. So after that, Lindsay, I'm going to go back to you. So David.
Great. Well, so we've talked about some of the challenges, which are very real and very significant. There is, I think, one piece of very good news at the policy level, and that is that we saw a very significant change in federal regulation last year that I think is going to create real opportunities for more kinship caregivers to be involved in caring for children. And I should say, I shouldn't assume everyone knows, while foster care is generally administered at the state level, or in some states at the county level, the federal government maintains very significant oversight of the way that states and counties run their child welfare system, because the federal government provides a significant amount of the funding that supports children in foster care and foster families. So the federal government has a very significant role in how foster care is provided around the country. And the federal regulation, which governs that, was changed in September of last year. So about 9 months ago. Before that, let me speak a little bit to the world before that change. Before September of last year, states were only permitted to have one set of standards for all foster parents, whether they were traditional foster parents, stranger foster parents, I guess as we could call them, or kinship foster parents. And so if a state wanted to make it easier for a family member to become a kinship foster parent, they would have to do that. But there were some of the normal standards that that family member could not meet. The state had to waive, even if we're talking about non-safety standards for foster care, the state would have to waive those standards on a case-by-case basis in order to allow a child to be placed with a family member. Now that is not only often, a very cumbersome process, especially in government, where any kind of administrative process like that can be difficult and take a while. But, it can also lead to agencies taking, a kind of a risk-averse posture. If you're actually sort of making the decision that you're going to waive a requirement so that that child can remain with a member of their family, that often is, a challenging thing to do. And it can create a tension between the desire to have kids with family and the sort of risk aversion in that process. Well, the new regulation that was issued last fall changes all that. And for the first time, it now allows states to establish kin-specific licensing or approval standards. So states now can have one set of standards for traditional foster parents, stranger foster parents, and a different set of standards for kinship foster parents. And what that means is that some of the non-safety, obviously safety standards cannot be waived in any situation, but some of the non-safety barriers that can often prevent kinship caregivers from taking a child. For example, many states have minimum square footage requirements in a home or for bedrooms or things like that that aren't really about protecting a child's safety. They may be about sort of traditional sense of what a home should be, but they often can prevent a kinship caregiver from taking care of a child. Those can now be altered by creating a kinship-specific set of licensing or approval standards if states find that some of those things are systemic barriers to kinship placement. The other thing this new regulation does, in addition to allowing a different set of licensing or approval standards, is that it requires that all states and all counties must ensure that kinship caregivers receive the same level of reimbursement as non-kinship foster parents. And that goes to the issue we've been talking about that Carol mentioned, that it is not enough to just place a child with a family member. You must continue to support them. And so if the state is providing a certain level of maintenance support to a family that is a traditional foster family, they must provide an equivalent level of support to a kinship family. Both of these things, we think, should be really tremendous incentives to states to expand on their ability to place children with family members with kin. And in fact, we are seeing great interest and great excitement around the country in implementing the new regulations. Michigan, I will call out, is the first state that adopted and received federal approval for a new set of kin-specific licensing standards. A number of other states have submitted plans to the federal government to do that. And another significant development is that a number of national organizations came together in anticipation of the new regulation and developed a set of model licensing standards that states could use to conform their policies to the regulation. And a lot of states are looking at those and determining how to implement them. So I think it's a really exciting time because of the change in federal requirements. And I very much hope that those of you on the call who are providers or advocates or family members, that you will encourage your states to look at and to conform their policies to the new regulations and use them as an opportunity to remove any barriers that may exist to kinship placement in your state.
Fantastic. Thanks, David. Jill, we'd love for you to introduce yourself and talk a little bit about what you're seeing in the States.
Great. Thank you so much, Lauren. It's really a pleasure to be here today with you and the amazing panelists. I feel like I have so much to build on from what everybody has already said. But I will start with an introduction. I'm Jill Yorty. I'm a senior policy specialist with the National Conference of State Legislatures. And by way of introduction, for those of you who may not be familiar with our organization, we are a nonpartisan organization serving a membership consisting of all state legislators and legislative staff in all 50 US states, territories, and Washington, DC. We were created by state legislatures, and we exist to strengthen the legislative institution. We provide a variety of services to our members. I work in our policy research division in our Children and Families program, and we cover any policy issue that would impact children and their families. We do have one resource that I'll have shared in the chat here in case you are curious and want to read or look at legislation more yourself. We do track child welfare related enacted legislation. Each year, this database is typically updated about once a week as states are in session. Generally, we see anywhere from 250 to 300 pieces of state legislation that deal with child welfare or prevention related issues in any given year coming from state legislatures. And I'm actually going to touch on something that David brought up before I dive into some of the other trends that we're seeing related to kinship care provider and foster care provider retention and recruitment. And that's following up on this idea of reducing barriers for families to become, or for kin to become kinship family providers when out-of-home care is necessary. We have an example tracked in our database from Virginia, House Bill 453, which was enacted this year, and it addresses the issue of barrier crimes for kinship foster parents by allowing placements if a certain amount of time has elapsed after a crime that did not involve putting a child at risk or in danger. This is typically 5 to 10 years, depending on the type of crime. But this really is one of the ways that states have already started to look at reducing barriers for kin to become kinship care providers when a child does need to be in out-of-home care. So kind of going back to the trends that we're seeing around kinship care, the first is that states are really thinking about how they're defining kinship care, and they are working to expand those definitions to be more relevant and focus on the relationships that children have that are close relationships with adults in their lives, beyond just thinking about who they're related to. For example, West Virginia House Bill 5151, also enacted this year, provides an expansive definition of fictive kin, which is one of the ways that states use to refer to non-relative kin, people who have a close relationship with a child. Maryland Senate Bill 708, also enacted this year, also looks at the definition of kinship and not only includes child's relatives through blood, marriage, adoption, tribal law or custom, cultural custom or practice, but it also includes unrelated individuals with whom the child has a strong familial or other significant bond. So it's really focusing on people that that child already knows and trusts and can feel safe with. The second trend that we're seeing at the state level is states putting into statute a mandate or a requirement that says kinship care is the first preference when a child does need to be placed in out-of-home care. For example, on this front, we have Virginia House Bill 27, enacted this year, requires local child welfare boards to consider kin placements as the child's first placement. And if the child is not able to be placed with kin, there's requirements for documentation about why this is the case, including documenting what efforts were made to identify relatives or fictive kin. The third big trend that we're seeing with states is that they're continuing to pay attention to issues around recruitment and retention when it comes to traditional foster care as well, and kind of thinking about the broader foster care system. So this relates to some of what Carol said earlier about the need to understand some of the more unique factors that are impacting each of these individual cases. New Hampshire Senate Bill 566, enacted this year, establishes a committee to study foster care families and the foster care system. And one of the aims of this study is to look at the unique challenges, concerns, and needs of foster care families. And this also broadly encompasses kinship care families too. And then an objective to come out of this is that the committee will make recommendations to improve and maintain a strong and successful state foster care system. Texas does something similar with Senate Bill 593 that was enacted last year. And this requires the Health and Human Services Commission to contract for an independent assessment of the state child welfare system, including on elements that may help reduce barriers for people to become a relative caregiver, a foster parent, or an adoptive parent. And I'm going to go ahead and pause there so I don't take up the whole time talking about state legislation. Again, there is that child welfare enacted legislative database if you're curious about other pieces of legislation that states are enacting.
Thanks so much, Jill. And Lizzie, as you went, tried to keep up and put everything in the chat that you referenced, but I will say NCSL does have great statutory references for all sorts of topics. They have a whole one focused on ACEs too, so highly recommend it as a source, but we gave you the specifics here in the chat. Lindsay, we had a question earlier from Gina about the changes that happen in Colorado. So giving Jill a break from talking about some state policy, can you talk to us about what exactly those changes were? And you did include the links, thank you.
Yeah, so there's been plenty of child welfare related bills that have passed in the last couple sessions, and we had an interim Child Welfare Committee in between 2023 and 2024 sessions to talk more about, go deeper on how Colorado could address some of the concerns in child welfare. But two of the bills, which I linked in the chat, one in 2023 that was focused on sort of front loading kinship searches for and family searches and requiring that counties do their due diligence at the beginning of a case. There was also a controversial provision that was in that bill that adjusted foster parents' ability to intervene in cases. In Colorado, previous to this bill, foster parents could intervene at 3 months, and now they can intervene at 12 months. This, I think, has contributed to the overall cultural issues surrounding foster parents in Colorado. We hear often from foster parents that they feel kind of undervalued, and this sort of contributed to that. There was a huge foster parent group with lots of foster parents that testified against the bill, not because of the kinship portion, but because of the intervention portion. And then following that and following the interim study that happened last summer, the other kinship bill that I linked passed this last session, and that does some really great things. One, the biggest being that you don't have to be certified to get a reimbursement. So previously you had to be if you were a kinship provider, you had to be certified to get a reimbursement that traditional foster parents do in Colorado. And so now kinship families, if you're not certified, you can get, it's a lower rate, but you can get some financial support, which, as I spoke to previously, can make all the difference in stabilizing a family as you take on additional needs of kids that you're caring for. So those are two really important shifts in Colorado, and ones that I wanted to highlight. And thank you so much, Jean, for asking the question. And then just really quick, I just wanted to expand on what Jill was talking about on foster parent retention. So we survey in the 7 counties that we work in Colorado. We survey the families every year and have been for the last 4 years. As you all may know, we don't survey resource families consistently across the country. And so, I think it's really important for us to know and understand the nuances of why families decide to leave if they do and not become recertified. And overwhelmingly, we get answers that when we ask the question, what would help you do your job better as a foster parent? And it is almost always communication and being more a part of the team. And so that to me is encouraging, because that's fixable. That's not an increase in resources, but it's discouraging because, as we all know, culture is one of the hardest things to change. And so really, I think a really important piece that Colorado is going to have to face is, if we want to retain our families, how do we fully embrace them as a vital component of the system, from the frontline caseworkers to county leadership to the Division of Child Welfare at the state level. So, and again, I think and we can go into this later, but I think there's lots of tangible things that counties can do to better retain families that doesn't cost a lot. That it doesn't. It's a culture shift. It's a bringing them into the team and working collaboratively around a kid and a family.
Thanks, Lindsay. That's really great. And lots of things that resonate on so many levels. I see a question in the chat from Caitlin regarding whether or not there's a time frame that from which kin could be identified, and then children who have been in long-term foster care could be moved from foster care into a kinship placement. I know that this was explored with me but I don't know anything about the actual legality of the timeframes. I imagine it's different in every state. I don't know if anyone, Jill, I don't know if you're able to speak to this at all, even at a broad level.
Yes, at a broad level I can, and I can say that it is going to vary state to state. Sometimes these timeframes are found in statute and are created and established by legislation. Other times, state legislatures will defer to the child welfare agency to set those timelines to some degree. So it is going to vary state to state. If there's a particular state you're interested in, I would look into both statute and administrative rules and regulations to find those exact timeframes.
Could I speak to that for a minute? Is that okay? So, number one, I want to strongly echo what Lindsay said about foster parents, resource parents, kinship parents, all being a full part of the team, being full respected members of the team. And that's a major part of QPI, is making sure that everyone is working together, and that in fact the most important member of the team in a lot of ways is the person who's doing the day-to-day care of the child. So that's kind of as background. Secondly, I think there are two elements of this move question, and it's very individualized. And it goes to the thing I was trying to say, but maybe you couldn't hear me, which is not all relatives are alike. So if you've been living from the day you were born for 2 years with a non-related foster parent, and now a relative who has never met you before, maybe has never met your mother and lives 5 states away, emerges and says, okay, I'll take the child, that's one thing. The grandmother who's been trying to get approved from the day the child came into care is another. And when we look at those two as the same, I think that's part of what causes this dissension between people, because if we look at what's best for the child, it's probably not the same in both of those cases. The second point I want to make is that I think our systems are particularly bad in moving children from one place to another, whether or not, and it's not really physically, it's not the move, it's changing you from one family to another, one culture to another. We don't really prepare children. We don't prepare the families. We don't respect the fact that relationships have been created. And if you are going to move and we still decide it's the best thing, that shouldn't mean that you lose the whole relationship with the other family. We don't respect relationships. So part of it is moving at all, but part of it is moving in such a way as to say you are essentially a package. This is when it's convenient for me to pick you up. I'm going to move you to the place where it's convenient, and you'll probably never see these people again. Again, I think I'm not looking at it from the point of view of either the relative or the unrelated foster parent. I'm looking at it from the point of view of the child. It is a terrible message to give a child that as long as someone was paid for caring for you, they really loved you, but you will never see them again. And they can only interpret that as once they stop paying you. They don't understand that the family can't see them. So this is a long speech, I know, but I feel really like this is a critical issue in this, because what states can do is to say we're going to raise our kinship numbers by unthoughtfully moving children from one place to another, not putting the time into what would you do if it were your child. So again, that's sort of a speech, but I do feel strongly.
Lauren, can I just make one comment on that too?
Go ahead, Lindsay.
Thank you. Carol, I just wanted to expand a little bit on what you were saying and couldn't agree more. I think one thing that we found too in our work in the last couple of years that has come out in our foster parent advisory councils is the the critical moment when a child is transitioned either home from a foster parent, from one foster parent to another foster parent, or foster parent to kin, that transition is often not done in a thoughtful way, and not because that is not a criticism of the caseworker. They have lots and lots of kids that they're managing, and moving a kid sometimes is something that you're able to check that box and get the kid in the place that they're supposed to be in, or whatever, for whatever reason. But the process by which a kid that may have been in that foster placement for several years, and then they're moved within 48 hours with no connection after that with the family that they've been with, is really traumatic for foster families, and oftentimes, and let's be honest, most importantly, traumatic for the child. And that how important it is to really think through as in Colorado, in counties, how we do that well. And we surveyed a county that we evaluated their transitions program, and we found that overwhelmingly foster parents, they didn't ask for, they don't want a thank you card, they don't want a gift card after spending time with the child. They wanted a phone call saying the kid has arrived and they're doing okay. And again, such an easy fix. And to Carol's point, a recognition of the relational component of child welfare, and how if we can get back to that, I think we truly will have better outcomes.
And again, although we didn't share this, I don't want to like belabor this point. We do have a lot of really good materials, which we developed with child development experts on how these kinds of transitions should be done, in particular, very young children, because there's still this myth that they won't remember. They're babies and they don't really understand what's going on, when in fact, it's probably the worst possible time because they can't understand. So although I did not share it, I'm happy to share those materials. The state of Louisiana has made it a policy. Technically, it's in statute in Florida as well. We're doing a lot of work with this in California, because I 100% agree with Lindsay. One of the main reasons why people end their relationship with the system as resource parents is that they thought they were helping kids. And in fact, what they're doing is traumatizing themselves, their own kids, and the kids who wound up leaving, because they don't know that's their mother anymore.
I'd like to jump in and follow up on this. Absolutely, those transitions are so important. Carol, it's great to hear that you're working with states on legislation around the transitions. I'd like to bring up one other detail from that West Virginia bill that I mentioned earlier relating to the definition of fictive kin. And in there, focusing on the substantial established relationship with the child, West Virginia has included in their definition of fictive kin foster parents with whom the child has already been placed with or has previously been placed with. So it is, some states are recognizing that important bond that can form between a child and a foster parent who's really there for them. And as we know, I know Casey Family Programs has done a lot of work around definitions of neglect. We know that definitions can so strongly shape how state systems are implemented and enacted.
Thanks, Jill. And I have another question for you. I think it was David earlier who talked some about disproportionality, and would love to hear a little bit more from what you know about states about the fact that Black, American Indian, Alaska Native children are overrepresented in the child welfare system. What are ways that we can work to address this?
Yeah, thank you. That's a great question. This is certainly a very prominent issue throughout the country in child welfare systems, the issue of disproportionality. It is a very complex issue. It is often entangled with the correlation that we see between poverty and neglect and other complex issues like that. States are, we've been tracking the issue of disproportionality in our child welfare enacted legislation database. So you can search for all of the legislation that we have identified over the last few years related to this. I do want to talk about a couple examples, concrete examples that are more recent here. The first being Minnesota Senate Bill 716, enacted this year. This is a substantial bill, so I won't be talking about all of the details that are included in it. I believe the link will be in the chat if you want to dive more deeply into it, but I want to highlight some of the goals of this piece of legislation. It recognizes that in Minnesota, disproportionality in child welfare has been an issue that has not been adequately addressed or resolved. And this kind of disproportionality can reflect unnecessary child welfare involvement for some of these communities and populations of children that are underserved by systems. So the first goal of this policy is to protect the best interests of African American and disproportionately represented children. The second is to promote the stability and security of African American and disproportionately represented children and their families by establishing minimum standards to prevent arbitrary and unnecessary removal from the home. The third goal of this piece of legislation is to improve permanency outcomes, including family reunification for African American and other disproportionately represented children. The second example I want to bring up was enacted last year by Montana amid all of the uncertainty around what would happen at the federal level with ICWA. Alaska Native and American Indian children are another group that tends to be disproportionately represented in child welfare systems. Montana does have a larger tribal population, and so they codified ICWA at the state level last year, asserting a commitment by the state to a placement that reflects and honors the unique values of the Indian child's tribal culture and is best able to assist the Indian child in establishing, developing, and maintaining a political, cultural, social, and spiritual relationship with that child's tribe and tribal community. So those are two very recent examples of how states have dealt with the issue of disproportionality for some of those populations that we know across the nation do tend to be overrepresented in child welfare.
Thanks, Jill. I've seen a lot in the chat about terminology used. It's certainly something I've encountered. I know Lindsay also just talked a little bit about the notion of strangers, all these things that can be challenging for people who are really trying to care for children in one way, shape, or form, whatever the actual official term is. David, there's another term I want to talk about, which is hidden foster care or kinship diversion. Could you talk a little bit about what this is and how the unintended consequences that we can experience as a result?
Sure, happy to do that. Let me also say and agree that I think we sometimes use terms that are really not respectful of folks who are involved in various ways in this work. And I agree that I think stranger foster care or foster families can be an uncomfortable term. I don't like the term fictive kin. That somehow suggests that they're not real kin, they're not really committed to children. So I think it's actually a really good caution that we should be very careful about the language that we use when we're talking about these issues. So with regard to hidden foster care, so we monitor very closely the number of children in formal foster care, right? And I talked earlier about how the number's going down across the country, up and down in different states. But the reality is that there are far, far more children who are living with family members other than their parents outside the formal foster care system than within the formal foster care system. There are way more grandparents and aunts and uncles and other family members who have taken in children because their parents are not able to care for them, at least for some period of time, but are not involved with formal foster care. And that is a generally accepted practice in many cultures around the country. But when the child welfare system is involved with a family, it really creates some complicated and important considerations. And there are some states more than others. Again, this is an area where there's a lot of variation around the country, but in some states more than others, child welfare agencies may place children that come to their attention because there are safety issues with relatives outside the formal foster care system rather than through the formal foster care process. This is a controversial practice. It's often called hidden foster care. It's sometimes called kinship diversion. It's controversial, and there's a range of views about it. So there's some who feel that doing this is actually sometimes aligned with family-centered practice. There are some families that would rather stay outside the foster care system because they're worried about the rights that they might lose or the intrusion of the government in their lives. There are some who feel that, as we were talking about before, there may be families that can't meet licensing standards to become foster parents. That may still be true. Hopefully it'll be less and less true with the new federal regulations as they're implemented by states. But there still will be families that in some cases can't meet licensing requirements and still want to care for children and so don't want to go through the formal system. So there's some who feel that kinship diversion can be an appropriate or acceptable process in some situations. But there are many others who feel that kinship diversion is concerning. It can be coercive to families. It can remove the legal protections that attach to families and children that they would otherwise have if they were in the formal foster care system. It can rob caregivers of the kind of legally mandated support that they would receive as foster parents. And there are a lot of advocates and others who feel that without formal foster care involvement, you don't have the oversight and you can't assure that children are safe and are moving to permanency and that their well-being is being assured. So there are strong feelings on both sides of the issue, and we're not obviously going to have time today to talk through that in detail. But I do think there are a few principles that are important to keep in mind as we think about placement of children with family, either within or outside the foster care system. First of those is that support to the child is essential. Children must be supported, and if a removal is essential, if a child needs to be removed for their own safety, it is absolutely also essential that the children have access to all of the economic and concrete supports that the system provides to them, whether they're within the system or not. They still need all of those supports. A second fundamental principle, I think, is that parents do have a right to due process and to legal representation. It is, I think, essential that parents have, are informed about all the options available to them, that this is not a coercive process, and that they understand the choices that they're making and the options that are available to them before they make their choices. And that just like children, caregivers also need support and need resources to care for children safely. And so even if they're doing so in an informal arrangement rather than through formal foster care, it's just as important that they have access to financial support and other kinds of concrete support that they need to ensure the well-being of the children they're caring for. So I think fundamentally what's really incumbent on states, counties, all jurisdictions is to make sure that whatever the legal arrangement, both children and their caregivers have all of the access to the supports that they need to make sure that children are well and can be cared for safely.
Thanks so much, David. Lindsay, you briefly mentioned before some of the work you do to help the government work in collaboration with kin and foster parents. Can you talk a little bit more about how that's working and kind of what those options are? Because I think that can certainly be a great option to have the lived experience represented and to help inform policies.
Yeah, so we have found that, so much like I've been talking about is so much of the work of improving the system and better retaining foster families and kinship families can happen on the implementation level. So yes, legislation is important, but oftentimes there's these adjustments that can happen that can make a huge difference in retention of families. And so one of the things we do, in every county we work in, like I said, we survey families and then we look each year at like the changes in sentiment with families, also where are the nuances of how we can better support them. And so one of the things that comes out often is how to better advocate for that foster families want to understand and be empowered to better advocate for the kids in their care. And so we establish advisory councils in any county that's interested in it. And we do, this we use some best practices from other organizations and Champs National, which was an initiative that just wound down about a year and a half ago. We use best practices from their work that we meet, we interview foster families, with a focus of how do we build a group of people that are solutions oriented and feel confident in giving feedback to the counties. And we meet monthly with a commitment for a year. And that really, we have seen it is by far the biggest body of work that we do. And it is, I think, the most impactful, whether it's helping a county reestablish regular communication with their foster parent group, whether that's a newsletter, some simple efforts like that to getting rid of what the county thought was a mandatory 8-hour in-person training every year that didn't need to happen, that could be done in other ways that were more conducive to foster families' lives, to the transition work that I just mentioned that came out of an advisory council discussion of how do we fix this particular process. So those are some ways that we really engage on the policy front. It bleeds into like actual tangible supports for foster and kinship families often, but also how do we adjust policies and programs that the counties implement every day to better support families.
Thanks so much, Lindsay. With that, I'm going to go to my last question, which is our final round. Go to each of you just briefly. We end every session asking what do you want the takeaway to be for our state policymakers, county policymakers? If there's one thing, one action item that you can give for each of them as a takeaway. Carol, let's start with you.
I guess my takeaway would be to make sure, and it's not something I've talked about, to make sure that in every one of these decisions, including which relative you select, including whether you move, including how you move, that they're really made as a team, including the young person if they're old enough, the birth parent, the family member or other caregiver, and the caseworker. Not that we make decisions and then get a team together to ratify, but in fact, we use everybody's thinking to make sure that what we're doing is actually serving the best interests of the child, not just serving the interest of the agency or expediency. So that would be my biggest takeaway, to make sure that we're really doing things as a partnership in team, which to me is truly respecting family and community.
Thanks so much, Carol. Jill.
Thank you. I'm going to go a little bit broad here with my takeaway. And this is something that we see with states quite often in the work that we do with legislatures. And that's the importance of really reaching beyond just the borders of the agency or institution or branch of government that you are working with or working for. These are complex systems. Humans are, and our societies are complicated and amazingly, wonderfully diverse. So in tackling some of these challenging issues, it's really important to be building relationships throughout these systems that are serving children and their families. I know we've seen some tremendous work by state legislatures when they are able to work across those branches of government and with providers in the community by talking about these issues and how all different parts of these systems can work together to address areas where harms are being perpetuated or created, and really improving the well-being of children and their families.
Thanks so much, Jill. David.
Well, I'm going to cheat and mention two suggestions. One is, and I referred to this earlier, I do hope everyone who is on this call will engage with your state or local child welfare agency about how they're dealing with the new federal regulations and really the steps they're taking to ensure that children, whenever possible, who are in foster care are placed with family members and kin. Because as we talked about from last hour, that's a really important consideration for their well-being. And the second is, I also encourage all of us to engage and listen to families with lived experience. As we think about policy change, as we think about practice, we have to understand how it is truly impacting families and children on the ground. And the only way to do that is to talk to people who have experience with the lived reality of being involved with the child welfare system. So I encourage us to ground all of our decision-making about policy and practice in the reality of the lives of the children and families who experience child welfare involvement.
Thanks, David. And Lindsay.
I was going to cheat and do two as well, but they stole one of mine on lived experience. But I'll just expand on that a bit. But number one, I think retention is recruitment. Recruitment is retention. If we can keep really, really great foster families in the system and retain them, they oftentimes get more experience and comfort and level of comfort in taking kids that have higher acuity needs. So you meet that need that we always say we can't find foster families who can take teens, take harder kids with harder behavioral issues, And so retention of those families is recruitment, and it's really important. And remembering that our best recruiter is a really fulfilled and happy foster parent. And so it just really focusing on the retention, especially in our recruitment and retention plans, that is part of the retention piece is just as important as the recruitment piece. And then just to expand finally on what David said about lived experience, I think I regularly interact with policy folks that don't have that day-to-day experience of what it's like to live in the system. And because it is such a frustrating system and so personal, and it's about families and it's relational and it's not designed to be relational. And the more we can infuse lived experience, whether that's parents, kinship families, foster parents, most importantly, youth, that will help us really truly have our policies reflect and serve families well.
I wanted to thank our speakers for joining us today. This has really been fantastic. I've been planning and looking forward to this session for longer than anyone would imagine. And this truly was everything I hoped for and more. And I want to thank all of the people who joined as well and asked their questions. They were really fantastic. It was recorded, so we will have the recording available in the next few days. And then we will also write up our takeaways that you can share with others, that will have a lot of links and also on the resources page on our website. And please come back and join us in September. That's when we're going to have our next Learning Network session. And with that, I will say thank you to everyone. I hope everyone has a safe and wonderful remainder of your day. Thank you so much.